Hello everyone, my name is Alivia Oktaviona Wulandari from English Literature of 5th semester, and I'm here to talk about mental health problems in Indonesia. Is mental health problems a significant factor in the high suicide rates in Indonesia? Okay, the news media and the national police have recently reported that there has been a rise in the number of suicide cases in Indonesia. Based on the data obtained, the number of suicides in Indonesia since the beginning of 2023 has increased compared to the previous year. It can be seen in the data from the National Criminal Information Center, or what we usually call Pusiknas, of the Indonesian National Police or Polri. There was 971 suicides in Indonesia during the period January to October 18, 2023. This figure has exceeded suicides throughout 2022, which amounted to 900 cases. The highest suicide cases occur in the young population aged 18 to 25 years. That age range does have a high vulnerability to suicide. This condition, as quoted by Compass, September 19, 2020, occurs because young people are indeed in a transition period from children to adults to experience physical, mental, and social changes. These changes make them prone to various mental problems, the culmination of which is having ideas and attempting suicide. The causes of suicide in Indonesia are complex and multi-phase. Some of the common factors that have been identified are family-oriented issues, financial problems, and mental health problems. In this particular discussion, we focus on of an individual mental health issues that drive them to commit suicide. The tendency for behavioral deviations that disrupt mental health hunts Gen Z. In society, issues of bullying, flexing, excessive narcissism, acts of violence, and even the phenomenon of suicide among teenagers often occur. In the 2022 Indonesia National Adolescent Survey stated that one in three Indonesian teenagers has a mental health problem. The same data states that one in 12 teenagers has a mental disorder. Anxiety disorders are most commonly experienced by teenagers. There is no influence of gender or age. According to Maria, these data are very worrying and must immediately receive serious treatment. It's unfortunate there are still many people who consider mental health or mental disorders to be taboo or disagree. However, if the initial symptoms do not receive treatment, they will continue and lead to the potential for acute mental disorders. If people experience physical health problems, they already know where to go. This is not the case if they experience ongoing emotional disorders as an indicator of mental health. We hope that mental health issues will be included in the health bill and the maternal and child health bill. This makes it easier for many parties to monitor. Meanwhile, community medicine practitioner from the Mental Health Collaborative Center and FKUI, Ray Wagyu Basrowi, revealed that mental health issues also apply to the population of pregnant women, breastfeeding mothers, and toddlers. Research conducted on the population of breastfeeding mothers in Indonesia during the pandemic showed that 6 out of 10 breastfeeding mothers were unhappy due to a lack of supportive support system in the family and community. There are several conditions that can cause mental health to be disturbed. One of which is trauma due to bad events that occurred in the past. There are several causes of mental health disorder, namely family history of mental health disorders or genetic factors, living in an unhealthy housing environment, and a history of sexual, physical, or other forms of abuse, victims of discrimination and stigma, isolated or socially isolated, or feeling lonely, and severe stress over a long period of time, head injury, brain disorders, or abnormalities in chemical compounds in the brain. Experiencing major economic losses, such as experiencing bankruptcy or having debt, job loss, unemployment, or homelessness, death or loss of a very loved one, abuse of illegal drugs or excessive alcohol consumption, having severe trauma, such as experiencing a serious accident or being in a war situation. Patients with mental health disorders can show different symptoms depending on the type of mental illness they suffer from. However, here are some common symptoms that sufferers with mental disorders can experience. The first one is difficulty focusing and concentrating. The second one is difficulty in dealing with stress or everyday problems, and easily emotional and prone to violence, likes to scream or fight, often hallucinating or becoming paranoid, withdrawing from social activities, loss of enthusiasm and interest in doing activities that were originally enjoyed. Thoughts arise of hurting yourself or self-harms or others. The emergence of thought of suicide, sudden changes in mood, changes in eating habits of patterns, and such as not having an appetite or actually eating too much, excessive feelings of anxiety, fear, worry, despair, and sadness appear, often feel tired and have problems sleeping, changes in sex drive, daily routines are disrupted, and productivity or performance decrease, difficulty understanding other people's conditions, feeling confused, forgetful, and irritable, or loss of self-confidence. A person must also always take care of his mental health, especially from an early age. Those who are underage often feel bad things for them. Therefore, adults who are close to them must always take care of their physical and mental health. There are several ways to maintain mental health. The first one is make your little one feel safe and supportive. Children's mental health in general means helping ensure your little one has a sense of security, helping children build good relationship with other people, and supporting their growth and development at home and at school. Ways to maintain children's mental health can be achieved by ensuring that children live in a safe environment where they feel cared for, love, appreciated, and trusted. Apart from that, children also have good relationships and mutual trust with family, friends, and the people around them. The second one is avoid children from traumatic events. Most young children grow up with good mental health. Usually, mental health disorders can occur if there is a traumatic event that triggers children who are already vulnerable to experiencing mental health disorders. Big changes can be one of the triggers. For example, moving house or having a younger sibling, where the child must adapt to a new environment or situation. And the third one is teach children to manage and express emotions. If a child has a good mental conditions, he will be able to feel happy and have a positive view of their self, can study well, be able to solve problems and recover from difficult situations, manage and express emotions in a safe way, positive, has a good relationships between family and friends. It is important to remember that mental health disorders can affect anyone from various backgrounds, and this condition is not a shame that needs to be hidden. If you experience symptoms or signs that refer to this condition, don't hesitate to immediately consult as a psychologist or psychiatrist. Okay, I think that's all that I will discuss about. And thank you for your attention. And goodbye, everyone.